So this project excited me for two reasons. First of all was the opportunity to work with the wonderful team at Children in Scotland. Children in Scotland has a priority to challenge inequalities, and that aligns really well with both my values but also with my own research priorities. We know from a lot of published international literature that childhood is critical. The Commission on the Social Determinants of Health pointed this out. So in order to tackle inequalities in childhood, we need to try to understand how this is experienced by children. Second, I wanted to get involved in this project because of the proposed methodology. The fact that young people were not just being involved in the project, but that they were actually leading the project was inspiring. This meant that their voices weren't just heard, but they were valued and appreciated. So those were the main reasons why I wanted to get involved. So the social determinants of health is an umbrella term that covers all of the factors that can influence our health and well-being. These range from the personal, for example, our genetics and our age, through to our behaviours that we engage in, up to our community, such as the housing quality within our neighbourhoods, the shops and services that are available within our neighbourhoods, the quality of schooling in our areas, air pollution, and so on. But what's really important within the kind of framework of the social determinants of health is that at the very top layer are the economic, social and political conditions. So we recognise then that politics and economics can quite literally make us sick, and it's the political decisions that are made around our neighbourhoods, around what's available and what's valued within our neighbourhoods that are important, and a social determinants framework helps us to understand this. For young people, it's critical also because young people age and grow within these neighbourhoods, and that this all has an influence as we move throughout our lives. So place can affect children's health and well-being in a range of different ways. One of these pathways may be through the material aspects that are available within our neighbourhoods. For example, the shops that are available where we can purchase healthy food or unhealthy foods, the facilities that are available in the neighbourhood, whether they're safe, accessible green spaces within our neighbourhood, and all of these factors can shape our health, both our physical health and our mental well-being. There are other more indirect ways in which place can affect health and well-being in relation to how we think about our neighbourhoods, and this relates to areas of stigma. So whether or not people talk about our neighbourhoods in a positive way or in a negative way. For some neighbourhoods, they're spoken about in an entirely negative way, both by populations outside of those neighbourhoods and by the media, and this can have a lasting impact on the health and well-being of the people who live in these areas and their reaction to the neighbourhoods themselves. There were four things that I found most interesting about this project. First and foremost was the methodology. The work that the young people have carried out in this project is fantastic. They were enthusiastic about it, and their results are important because we know from the academic literature that the environment matters in childhood, but to bring different voices to the table is really critical. Second theme that was really clear within this report was that the environment can impact negatively upon these young people. And what came through as a key theme was that of safety. And what was highlighted within this were issues to do with crime, drug abuse and alcohol use. In particular, this made young people afraid to use some of their local spaces. If we think about the use of parks and green spaces, some of the young people mentioned being afraid to go to use these spaces because of who was using these spaces and in what ways these spaces were being used. This will have an impact both on the young people's physical health through the lack of physical activity, but also in their mental health, in not having the ability to engage with all of their spaces. Third, the young researchers talked about the reputation of the area, and we know that the reputation matters for mental well-being. Related to this, they talked about crime in the area, behaviours in the area, but also the physical features of the neighbourhood itself, such as broken fences or damaged properties. In terms of this, the young people mentioned that some people may not want to bring friends home to their area because of the reputation of the neighbourhoods themselves, and this can be isolating for young people and damage social networks. Finally, it's also important to recognise that the young people mentioned some really positive aspects of their neighbourhoods. For example, their friends and their social networks, their families, and how these can foster support the importance of trust in the community, and also if there are some high quality green spaces within the communities. It's important that we focus on the negative to try to change that, but also that we recognise the positive features of the environment so that we have some policy levers to pull in order to tackle inequalities and improve the neighbourhoods in which these young people live.